Number 7, presentation, Martha Teaberry monthly update, Kevin Evans. Yeah.
Good afternoon, Mr. Chair, Commissioners. I noticed that the meeting goes till 4 o'clock, and I have about 2 minutes left.
Well, make it quick.
We'll do it. I was actually asked not to do a presentation so much as a conversation. We noticed that from the presentation at our last meeting that there is a varying amount of information about who Martha Teaberry is, what we do, why it's important to the county. As a matter of fact, it was posed to me respectfully, why should the county commissioners care about Martha Teaberry? And I thought that was a valid question. So I'm hoping to answer that, give a brief overview of what we do and why we do that, why it's important to the county, and then also have some time to answer any questions that you may have. First of all, Martha Teaberry is a skilled nursing facility. That is different than a regular nursing facility in that we also take rehabilitation patients, and because of that, we have an additional skill level that we're required to have from the federal government. The majority of our clientele come from those that are indigent, which is a different business model than most facilities. You see a number of beautiful facilities being built all over eastern Michigan, and the vast majority of those are high Medicare and private pay. The reason they go for the Medicare dollars is they make a significant more amount of money per resident than a Medicaid resident. As a matter of fact, oftentimes they discharge their residents to us after they exhaust their Medicare benefits because they simply can't make the money. Now, the good news about that is the state and federal government recognizes that as a county facility, our responsibility is to focus on those that have the inability to pay, and they pay us a higher Medicaid rate than a for-profit facility, and indeed even than the not-for-profit facilities. So a county medical care facility has a benefit in that way. We can provide outstanding care to those in our area because we get paid a little bit more to do that. We don't have to go after the Medicare dollars to subsidize. Are there any questions on that so far? Good. Certainly.
Is that statutory? The fact that you get paid more because you're a county facility?
Yes. Yes. We're considered what's called a Class 3 facility. Mm-hmm.
Yes.
Mm-hmm. Now, a little bit of the history here. I do understand that that several years ago, the county helped subsidize the facility pretty significantly, $2 to $4 million a year. We don't have that anymore. As a matter of fact, when there was a transition, it was put upon the Board of Human Services to make sure that the risk is mitigated to the county. We understand that our responsibility is to be good fiscal stewards of what we bill. Now, our budget is a little different than other budgets that you work with. The majority of your budgets are allocated budgets. They're line items, and they can only spend that much for that service. We have to provide the service, and then 30 to 45 days later, we are allowed to bill for that service and hope to get that money back. Here's something else. When we spend money, Medicaid actually tells us how much we're allowed to bill. So even if we spent, for example, $500 a day on a resident, they're only going to pay us the rate, the aggregate rate, which is less. Any questions on that so far? That's also why it's important that we're good fiscal stewards, because Medicaid does not allow for specialty items and things that Medicare sometimes provides, or if you are not in a facility, they consider that part of what is called a per diem, which means if they're in our facility, we have to provide those things. There was some conversation, as a matter of fact, about maintaining the facility here, and I would encourage the commissioners to stay focused on this tremendous asset for Macomb County, because we do great work. We just had, actually, if you don't mind me giving one example, we had a gentleman that we discharged to another home because he no longer needs skilled care. So we did a quick interview with him and asked him, what was your concerns when you first got there? He said, I had no concerns. He said, I heard some stories. He said, but I knew people that lived there. My mom actually was there. And he said, I had no concerns. He had some health issues which caused him to have both of his legs amputated. And he had to learn how to live life again. And successfully, we had a going away party for him on Friday. And we asked, is there anything else that you... Excuse me. We asked him, is there anything else that you'd like to share with us before we end the interview? He said, I don't want to go. I'm going to miss you all. He said, but I know I can't stay. So we're going to have him come back as a volunteer, because it's just a neat thing to see the love that our staff has for people, and it's a huge success to be able to take somebody that would not have had the ability to be rehabilitated, as a Medicaid resident. That's why he can't stay here. We've actually rehabilitated him past our ability to keep him. So how do we connect is another question that was asked. How does the commissioners connect with Martha Teaberry? Well, a few years back, the commissioners formed a one-year joint operating agreement that at the end of that year put a few things in perpetuity. Essentially what occurred is they said, for a year, we're going to do a reorganization and a business plan that transitions the running of Martha Teaberry to the Board of Human Services in line with a Public Act 280. PA 280 is a social welfare act, which, among other things, has specific regulation and oversight as to how an MCF, a medical care facility, can be in place. What that did was it said at the end of that year, the responsibility of running the business of Martha Teaberry will be conveyed upon the Board of Human Services. The county commissioners retain the right, which of course is already in PA 280, that if you choose at some point to no longer have the facility, you can vote to not have the facility. The third and probably most important part of the statute and of your responsibilities is that you're required to appoint two board members to the Board of Human Services. The third is appointed from Lansing by the governor's office. What that means is every couple of years, there's somebody new, or that you can reappoint, or you can say, you know what, we'd like to have a different vision going ahead. Now, my responsibility here is to keep you as informed as I'm able to do it in the time that I have, knowing that you have so many other things to be concerned about, so that when the time comes to appoint, you can say, yep, they're doing a fairly decent job, or no, we need to go someplace else. The Board of Human Services' responsibility is to hire the administrator to make sure that I am doing the job that they expect me to do. They set the budget, put it in place, and I provide that to you. Are there any questions on that? Because I know that sometimes there's some questions that are related to that.
Not right now. Do we have Commissioner Leonetti?
How long do they have to serve? How many, the commissioners are on the board and the person from the governor's office, what's their term of service?
It's a 3-year term.
Okay.
And they are staggered every year.
Thank you.
You're welcome. So next year we do have one other person whose year, it's in their 3rd year, and then after that it would be the governor's appointee, and then we'd start back over again. Okay.
Do we have a motion to receive and file? A motion by Sauger? No. Support? We have a motion and support. Kevin, please continue.
Oh, my apologies, Mr. Chair. The other aspect that we have on working together is the building belongs to the county. You allow us to use that. Right now, we have about 5 years left on a bond for the improvements that occurred right around 2000. Our goal is to work with you and let you know what's happening, what we need. A lot of our infrastructure we need to improve upon. There are some new emergency preparedness for active shooter and things that we have to enhance our security on. I'll be bringing those to the board over the next several months so that you're fully aware of what we hope to do. And we also have full intent on not asking you for any money to improve your building. It is something that we believe we can do. It is, with as difficult as the job as you have, if we can do that, it's the right thing to do for us to be able to do. We have something that is some money that just came in called certified public expenditure. I won't get into that too deeply, but just to let you know, we will have probably $3 or $4 million that we can specifically put directly back into important infrastructure that we need to do. From time to time, actually, for those that have been here for a while, when I first arrived, I had the privilege of serving through a very difficult time, and the commissioner's office was getting calls, actually several a week, and the executive was as well. When things, when there are challenges and you get a call, it's important that you're informed as to what our goals are, what our vision is, and also, if I can and am able to give you a heads up as to what's happening with our changes. Some of our policies we talked about, for example, we talked about our attendance policy, that we changed that, and I would expect that people would say it's not fair when they're no longer allowed to work there. But you might get a call from time to time, and it's important that you're comfortable that your board, Board of Human Services, two of whom you appoint, and your director is doing a good job for you. I would love you to come over and take a look at the facility. You're welcome anytime. But if you have any specific questions, oftentimes what happens, for example, in the past, a commissioner would say, Kevin, could you add this to your meeting next month, and I can bring that for you. If you let the board know, or if you just let me know during that time, we'll make sure it happens for you. Our goal, again, our budget's very different. If we don't have the number of staff, I've got to make sure I cut costs. I have to do that. I have to be proactive in that. But I also let you know ahead of time. And if we did our normal presentation here, you'd know that we did very well in January, and that I would tell you that it won't be as rosy in February, because we invested intentionally in our infrastructure of training for our electronic medical record at a time when our census was as low as it's been in 10 years. But we did it intentionally. We'll be able to make that up. So it'll look bad in February, look better in March.
Very good. Thank you, Kevin. Any other comments or questions? Commissioner Smith.
Thank you, Mr. Chair. Thank you, Kevin. First of all, I'm not sure if you were done with your presentation. Andre
I am
has
done whenever you
someplace
say,
to
Mr.
be.
Chair.
No, well. Second of all, I do want to just give you a compliment here, and I know that you guys hear way more complaints than compliments. In the last few months, I've had several very good friends of mine have their mothers in your place, and one of them has moved on to better things. However, I'll tell you that the family has told me several times how much they appreciated the care that they got there. They even had staff members attend her funeral. I mean, that's the kind of staff that you're building over there. And I just wanted to let you know, another really good family friend of mine had just recently had to put their mother in there, and they didn't think they could ever do it. And you know how that goes. And they again, it's been a month or more, and they could not be happier with the care that they're getting, that their mother is getting, and how happy she is there. And I just want to tell you that because I know you know it's easy. All the complaints are are out there freely given out, but the compliments aren't such. And for you new commissioners, the difference in hearing about Martha Teaberry now as opposed to a few years ago is it's a whole different world. We look forward to hearing what's going on at Martha Teaberry. We're not gritting our teeth going, oh my God, what's happening next, right? I mean, kind of thing. And that's where it was getting to. And there was a lot of external factors going along with that too. But I just want to let you know from my perspective what a great facility is. It's a fantastic facility for the county to have just because of the fact that it really does catch. It's a safety net for so many people that would be in facilities that you would not hear those compliments about. So I just want to thank you again. I think you're doing a fantastic job. Kevin and I meet regularly now, and I know he comes into the board all the time, but he is very open to any of you going to see him and touring the facility. And I just want to thank you again for what you've been doing.
Thank you so much. I thank you on behalf of the team. One of the outstanding team members that has really led the charge and the change in quality I have with me, if you'll allow me to introduce Demetria Gross. She is our deputy director, and she is a tremendous mentor to our director of nursing, and she is our compliance officer. So looking at melding quality and compliance as it should be, she's been really taking the lead, and we're seeing steady improvement across all of the things we were talking about over the last year when you saw those grids going in the right direction. I really do give the credit to Demetria on that. So,
Well, welcome aboard. Commissioner Carabelli.
Thank you. Thank you for the presentation. When you get the opportunity, can you forward on to the board chair for us? I'd like to know about your, and break down your cost for your food preparation for the residents. I'd like to see what it is per meal, breakfast, lunch, and dinner. I'd like to see what your actual costs are.
sure.
So you don't have to do that now, but when you get a chance, if you can break that down and forward it on to the board chair, I'd really appreciate it.
We'll do our best on that. We look at a per patient day. We're required to provide 3 meals plus snacks, and but I do understand in context. We also work with the adult day. As a matter of fact, when we're speaking, when Gary was up here, Demetria and I were talking about it because Demetria also has direct supervision over our adult day program.
Okay.
And but we're learning that process and that program. We're going to be looking at how we can maybe help in that way too. So.
No, just from my own perspective, Martha T. has done a marvelous job over the last few years. I had a mother-in-law and an aunt-in-law there, and I was very, very pleased with the care that they received there. And as the chairman said, some of the people there attended both of their funerals. My aunt-in-law ended up being 100 and a half. So she had enough time. But Martha T's done a terrific job and has been a tremendous asset to the county. I wish you well. I hope things are going in the right direction.
They are, Mr. Chair. We are, you know, a lot of what happened before did impact the staff.
Right.
And we've been able to really help them one heart at a time, just helping them focus forward. And it's been a tremendous change.
There you go. We have a motion and support to receive and file. All in favor, please vote.
Those that aren't in favor, don't vote.
Yes. Or think about not voting. All right, thank you very much.
Thank you.